So it just seems like common sense that if someone wants to improve their health, they have to become educated about nutrition and what foods to avoid and what foods to be consuming more of, especially nutrient-dense foods. So part of the program must educate people about nutrition and why it is that nutrition is important. A lot of people just take it for granted. They feel like they can eat just whatever they want and the body's going to still produce energy. But nutrition is really important for, of course, providing nutrients to the cells, but also to increase or improve the pathways of cleansing and detoxification. So I think nutrition, it's another pillar, another part of the foundation of recovering your health. So let's investigate that a bit. So no matter what condition a person is experiencing, whether it's more in the mental, emotional, or whether it's just simply physical, no matter what, it's really a major component of recovering health is all about how to improve the function of mitochondria. It really comes down to that. And you can see how many components are involved thus far with understanding dysfunction and how, what we've talked about thus far, how to improve the function of the mitochondria. So we must increase the cellular. What are you going to improve in your body to experience health? It has to be at the cellular level. What else is there? There's the cells, there's the blood, and there's the lymph. We've got to improve the function of cells. And part of that is understanding how to detoxify, how to purify the body of residues that have accumulated since the day you were born and possibly even when you were in the womb. You can't believe the studies that have been done about what chemicals are found in fat tissue, in biopsies, and also studying cadavers. They found toxins in one study of DDT, which I believe was outlawed in the States around late 50s, early 60s. And even though these fat biopsies were done in the 80s, 90s, and the 2000s, the first decade of the 2000s, DDT was in the fat cells. I'm sure we're probably getting exposed to DDT from other, importation of various foods. I don't know if you know this lady's story, Dr. Wall, MD, and was diagnosed with MS, I believe it was MS, and she went the medical route, tried everything, and kept declining in her health, and decided that as a physician she needed to take care of herself, and did a tremendous amount of research, and finally figured out that her condition was mostly due to mitochondrial dysfunction. So she designed a dietary regime, and this was part of it, eating these foods every single day in fairly large quantities. These are rich in macronutrients, trace minerals, and a wide variety of nutrients that are coming from these foods. Also including a lot of protein in her diet and fish oils, etc. And you can see what progress she made in 1 year. You can tell she's on the bike, but you can see that there's still lingering symptoms. And I don't know, I believe that what took a year for her to do might have been done in a much shorter time if the IV NAD had been applied in her case. But you kind of have an idea of the hundreds of millions of people that are experiencing the degree of severity of symptoms as Dr. Wall, no matter what the condition might be, and how much we can help through nutrition, through IV NAD, through purification, etc., and get people back to experiencing life once again. So another part of helping the mitochondria to not only produce more energy, but also to increase the number of mitochondria inside cells. We're going to talk about intermittent fasting. So let us say that you have your dinner and finish around 8 o'clock in the evening, and you go all the way through the whole night, and now we're waking up in the morning at 7 o'clock. And from that time on, and I'll show you the next slide, you have nothing but liquids. My favorite is a half of an organic lemon squeezed into a glass of water. And for those with a little bit of a blood sugar dysregulation problem, putting a tiny amount of maple syrup, which is also rich in minerals and trace minerals, into that lemon water is something else you can do and still remain in a fasting state. So you start it when you wake up, nothing but liquids. I'll tell you a bit more about this. And then all the way until noon. So that means that you have been fasting, or not providing your body with any nutrients, that maybe vitamin C and a few other things in the lemon, from 8 in the evening all the way through the night and all the way until noon. So that is a 16-hour fast, so to speak. And then at that, oh, here's something. So you can also use juice from when you wake up until noon, but it needs to be only greens. And what we're trying to do here, and I'll explain this in a moment, is we're trying to keep the blood sugar very, very even. So nothing sweet. And this product, Greens Smoothie, I did a lot of research on companies doing dehydration of organic fruits and vegetables. And their process is extremely low heat in their dehydration process, extremely low heat, which means it prevents two things. One is the oxidation of the food. Oxidation is what ages and causes food to go bad. And the other is that it preserves all the enzymes in the food. Enzymes are extremely important. So at noon you have your lunch, and in this case this is a paleo type of meal with lots of protein and fats and vegetables that grow above the ground with low carbohydrate content. So again, it improves intermittent fasting improves mitochondrial function, and also increases the number of the mitochondria. Low-calorie diets will also accomplish something similar, but I find it's difficult for people to start looking at calories and counting calories, etc. But if they just skip one meal, they're lowering their caloric intake. And so, of course, if we increase the number and the function of mitochondria, we're also improving detoxification of cells. And also the digestive system has a time to relax and not have to work so hard. That's happening when we don't eat food. So from dinner time all the way through lunch, digestive system is having a chance to recover. So cells, besides all that we've talked a lot about a lot of nutrients, all the B vitamins and antioxidants, etc. But cells need they need two things for sure. One is oxygen, and the other is glucose. Here's an illustration of fat cells. Fat cells, again, store fat as potential energy. During this time of intermittent fasting, even when you're sleeping, all the cells of the body and brain require two things: oxygen and glucose. So let's say we get up in the morning, we're walking around and doing things, our muscles are working, our brain's working, we're thinking about what to do. Glucose in the blood is being transported from the blood to the cells. And that means your blood glucose or blood sugar is going down. So when that happens, the body, primarily from cortisol, will indirectly signal the fat cells to release fat, which is basically free fatty acids coming out of fat cells as the alternative to glucose. one more thing. As the fat's being pulled out of fat cells, toxins are coming out. Toxic residues that were stored in the fat cells are also coming out. These free fatty acids, they are like high-octane fuel for the mitochondria. And of course, if the mitochondria are functioning better, then we have residues and chemicals coming out of the cell. And this is why intermittent fasting is a really good regime to, or habit to get into. People ask then, shall I do it every day? And I tell them, try it once and see how you feel. Most of the time, people feel more stable or more energetic when they're doing intermittent fasting, and they want to continue. So that's it for this subject, and we'll go on to the next video.